Hi, I'm interviewing Dr. Chris Waters, my microbial genetics professor here at MSU. Dr. Waters, I have a few questions for you.
All right. Hi.
First question is, do you think it is ethical to use gene therapy to cure someone of a disease? Why or why not?
Yeah, absolutely. I consider it just another type of treatment, and I think once it can be developed to where it's a reliable cure for many of these diseases, I think it's great.
Do you think that it is ethical for parents to choose their child's physical characteristics such as height or hair color?
I think that's going too far. I think changing things like these frivolous kind of traits that don't affect a person's health is not something we should be doing. First of all, I think that there's a lot of cost associated with these kinds of treatments, so I think that would be very wasteful in terms of cost. Secondly, I think these traits, you can't really select like what are the best traits. So if we think about the human species as a population, saying this trait is better than some other trait is not, we can't really say that. So I think that's pushing it too far. And third, there's risk associated with these treatments. There's always risk with any sort of medical treatment, and I don't see subjecting children or embryos or whatever to these kinds of treatments is worthwhile for frivolous reasons.
Mm-hmm. Along the same lines, do you think that it is ethical for parents to choose their child's personality traits such as temperament?
Again, I would say no based on those reasons. And I think we need a lot of different kinds of temperaments in this world.
Okay.
So,
if the technology was available, would you give your child gene therapy to give him or her a competitive advantage over others?
No, we're there. Yeah, if it could make my son get in the NBA and make millions, yeah. No, I'm just kidding. No, so I would not. Along the same lines, no, I don't think that's ethical to do that. And a lot of times, like, people are really driven more by the challenges that they have to overcome. So I think you're doing a disservice to your children if you do something like that.
Mm-hmm. Where do you draw the line between playing God and acceptable genetic enhancement?
So the line would have to be if it's something that's threatening health or someone's well-being. I think it's okay. If it's not something that's doing those kinds of things, then it's pushing. It's past the line.
Mm-hmm. Do you think that it is okay for human genetic enhancement to be a function of healthcare?
Yeah, I do, and I think it someday it's just going to become a normal kind of therapy, and I think it'll cure a lot of diseases. I think it should be part of healthcare because otherwise, then you have this situation where only the most rich people can afford the treatments, whereas the poor people cannot. And I don't think that's the way we want our society to be.
Okay. Thank you very much.